Hello, my name is Nerali Bracetta, and today we're going to be taking a look at some of the side effects that accompany a pandemic. We'll be discussing pandemics in general, the emotional and mental distress that accompany it, as well as the physical effects and the social impact it has. Starting off with pandemics. Well, what exactly is a pandemic? A pandemic is a disease that affects a large number of people in a large geographical location. So just because there has been a sudden spike in cases of a disease doesn't make it a pandemic. It has to spread to several other countries and affect a large number of people to be classified as a pandemic. Now, some of the most recent pandemics that we've had include the 1918 pandemic of H1N1 virus, the 1957 pandemic of H2N2 virus, the 1968 pandemic of H3N2 virus, and the 2009 H1N1 pandemic of H1N1 PDM09 virus. Now we'll be going over the emotional and mental distress they cause and how to prevent them. Some people affected mentally and emotionally by pandemics include, but is not limited to, adolescents, low-income families, people experiencing job loss, people working from home, healthcare workers, and people living alone. Here we can see that 40% of US adults reported struggling with mental health or substance use. 31% of that 40% reported having anxiety and or depression symptoms. 26% experienced trauma and or stressor-related disorders symptoms. 13% started or increased substance use, and 11% seriously considered suicide. This is a poll conducted on adults 65 and up who said they had experienced a negative impact on their mental health by stress or worry related to the coronavirus. The poll began with a whopping 27% of adults saying they were negatively impacted. It then rises to 31% 15 days after the initial poll. The percentage stays the same until the poll taken in July, where the percentage skyrockets to 48%. Now we'll be taking a look at some of the most common warning signs, which include having significant mood swings, fear and worry about health, financial situations, or loss of support systems, having a dark social media presence, or increased alcohol and drug use. Some of the things that you could do to potentially help you avoid feeling this way are taking care of your body, connecting with others, taking deep breaths, stretching, or meditating. And for parents that see these signs in their teenagers, they should try to create a safe space for them. They should also start the conversation with an observation. An example of this could be saying, "Oh, I've noticed that you've been having a difficult time getting up in the morning. Do you think that you might be depressed?" You should also never judge what they say, whether you like it or not. And you should immediately connect them with a mental health professional. This could be a school guidance counselor, a therapist, or even your physician. I've also provided some additional tips that can help you cope with the distress. First off, having self-compassion. This is important because you need to realize that you can't control how you react in certain situations. So it's completely normal to feel stressed or anxious in certain situations. You should also stay socially connected. Although you should stay physically distanced, it's important to stay socially connected for that support provided. You can FaceTime, text, or do basically anything that will keep you connected. You should also look at the unique opportunities that you've been presented with, because maybe now you have enough time to spend with your family or to figure out something about yourself that you didn't know before. Now, engaging in tangible activities that make you feel like you're making a difference are great because that way you can focus on not bringing yourself down or not being productive. Lastly, you should moderate your media exposure. Although it is important to stay informed, you shouldn't be watching the news outlet day in and day out because that will cause unnecessary stress and paranoia. Moving on to the physical effects that come along with a pandemic. Taking a look at some of the physical signs that indicate that there might be something deeper going on. These signs include worsening of chronic or mental health problems, sleeping too much or not enough, changes of appetite, headaches or body tremors, or tremors or muscle twitches, or being startled easily. Some things that can help you overcome these effects are using your time to relax, seeing a doctor, and not thinking about the pandemic as often. Onto the social impact that pandemics cause. Well, what is social isolation? It's having a lack of social connections that can lead to loneliness. The negative effects of social isolation include the increased risk of mental and chronic health. Some of the warning signs that come with social isolation are deep boredom or general lack of interest, losing interest in personal hygiene, poor eating and poor nutrition, and feeling significant despair or having a clutter and hoarding in your house. Some of the things that you can do to avoid feeling like this are getting a pet, finding a hobby, learning something new. This could be something like baking or cooking or even knitting, and even creating and maintaining meaningful friendships. So today we've discussed pandemics, which are caused by viruses, we've had many of them in our history. Emotional and mental distress. So if someone's behavior has significantly changed, there might be something wrong and you should definitely try to find the adequate help. The physical effects. So your mental and chronic health can be affected, and the social impact. You should try to form meaningful bonds and do things to keep you occupied. I've also included a list of resources for your needs. These include numbers to the National Domestic Violence Hotline, the National Child Abuse Hotline, the Disaster Distress Helpline, and many more. And I appreciate you using your time to inform yourself about the emotional, physical, and social dangers that accompany pandemics, especially during these times. Thank you.